I want to start by addressing the deal struck between 3M and the U.S. administration last night. There's still a lot of work to be done to secure enough PPE for the province of Ontario. We're low on supplies, so this news was certainly welcomed. It's a positive development. But we can't only rely on the global supply chain right now. We can't count on other countries. We need the federal government to come through on their commitments for supplies to the province. And we need to keep building our own capacity. We need to look after ourselves. We need to be self-sufficient, because my responsibility is the people of Ontario. Our responsibility in Ontario is to each other. And we have the manufacturing might, we have the ability to make anything here in Ontario. And Ontario is stepping up. We have thousands of businesses, colleges, universities, and other organizations who have donated millions of gloves, masks, gowns, and other supplies. We've received masks from Bruce Power and OPG, 10,000 N95 masks from the University of Guelph, 125,000 gloves, and 75,000 masks from Algonquin College. And the list goes on and on. It's absolutely incredible. This is the Ontario spirit. Nico Apparel, Felfab, and Copley Apparel in Hamilton have banded together to make thousands of masks and gowns for the local hospitals. And Ontario Power Generation is partnering with Ontario Tech University in Durham to make face shields using 3D printers. And earlier today, I personally picked up the first batch of medical masks made right here in Ontario by Woodbridge Group. These masks will be made here in the millions. My friends, this is what the workshop of Canada looks like. Once we get Ontario's manufacturing powerhouse going, it's a machine that can't be stopped. Our companies are stepping up. They're retooling, providing our frontline workers with the resources that they need. And today, we're calling in reinforcements. We're calling for healthcare reinforcements, more boots on the ground to support our healthcare workers. And there's no time to waste. We're launching an online portal to match and fill much needed healthcare positions with those willing and able to work. This new online portal will help match skilled frontline workers with our healthcare employers. We've heard from so many healthcare professionals out there. They've been calling us, they've been writing us, they're asking, how can I help? They don't want to sit on the sidelines and watch as this virus spreads. They want to get out there and make a difference. And we need them. And my message today for those on the front lines, for those working in our hospitals, clinics, and assessment centers, my message to our healthcare heroes is this: help is on the way. So if you're listening, if you have medical training, if you want to save lives, we need you. Join the fight today, because we need every person in Ontario in this fight. We need an army of 14.5 million people. We need you in this fight. We need every available person to help, whether it's staying home, working in our hospitals or long-term care homes, or putting food and medicine on our shelves. We're all part of this. And with your help, we will win this battle. And our province and our economy will come back stronger than ever before. Thank you, and God bless the people of this province. Thank you.
Thank you, Premier. We are truly living in extraordinary times, times that are testing our spirit and our resolve. But the thing about living in extraordinary times is that it often leads to extraordinary stories. One of the most inspiring things that I have witnessed since the start of this outbreak is the true spirit of the people of this province. Because as the reality of the challenge we face became more apparent, we began to hear from people who wanted to help. Thousands of volunteers have reached out to help in any way they can. And we're very grateful to each and every one of them for stepping up in these unprecedented times. Many of these volunteers have their own background working in the healthcare system. Some are retired or haven't worked in the field for some time. Others are students or professionals who were trained in other parts of the world. But they all share in the basic desire to help those in this time of need and have the skills to do so. We are so very thankful for their willingness and desire to help. This new health workforce matching portal is going to match skilled frontline healthcare workers with employers, enabling us to ensure help reaches a range of different care providers or public health units in need of more help. Healthcare providers in need of support should add in job postings so that we can connect volunteers with the right positions and get these critical roles filled. Doing so will help us fill important gaps in communities across Ontario as we continue to work together to stop the spread and beat COVID-19. Thank you.
Okay, we'll go to questions to the mic. First question.
First question comes from Laura Stone of the Globe and Mail. Please go ahead.
Hi, Premier.
Hi, Laura.
Thank you.
Thank you.
I just have a question regarding supply. You mentioned off the top that Ontario needs to be self-sufficient.
Yes.
How long do you think it will take for the province to be able to produce enough supplies for the province? And as well, what exactly are you expecting the federal government to do if they're having difficulties with global supply as well? What more can they be doing to supply Ontario's needs?
Well, first, to answer your first question, Laura, every single day, a new company's coming up and saying that we need to help out, and here's a donation of masks, or we're starting to produce face shields, or we're doing surgical gowns. So it's every single day. And when we had the call for action, the response was unbelievable. We were running through every single call, and just a message to the folks out there that want to volunteer or have a product, we will get to you. And it's just the sheer volume. It's amazing how the people and the businesses in this community in Ontario have just stepped up, and they want to support us any which way possible. We had a food company, I'll mention them, St. Helens Meats. They're saying, hey, we can supply soup to as many hospitals as needed for the frontline healthcare workers. Just little things like that turn into huge areas, and everyone's pitching in, and we're so grateful. Laura, I could come out here and talk about 20 companies a day that are helping out. And as for the federal government, they're doing a great job. I want to thank the Prime Minister. He's doing a phenomenal job and making sure that he's working with the U.S. administration along with the Deputy Prime Minister Freeland. They're both doing an incredible job working their channels through the White House and working with 3M. It was a real positive news that I heard last night, but there's still a tremendous amount of work to be done. So we can't sit back. We just have to continue working hard and finding new suppliers, and that's what we're going to continue doing. But again, with the federal government, I can't ask for a better partner than what they've been doing.
And just before I move on to my follow-up, which is for Minister Elliott, do you have a timeline on when Ontario will be self-sufficient?
Well, again, as this pandemic increases and we do more testing and more people end up with COVID-19, the supplies are going to go up. But what I can tell you, we're getting accurate numbers from all hospitals. We're looking at their burn rate, seeing how it's accelerating and measuring it, because you can't manage anything unless you measure the usage of all the PPE items that we have out there, and that part, they're getting well organized on that, and then we'll have a better idea of the burn rate. But it really fluctuates, Laura, and we can never sit back on our laurels. We have to be working constantly and coming up with new creative ideas, and Ontario can manufacture anything, absolutely anything. And I think you said you had a question for the Minister of Health, if I'm not mistaken? No? Okay.
Next question.
Next question comes from Cynthia Mulligan from City News. Please go ahead.
Premier.
Hi, Cynthia.
My question today is actually very much online with the portal that you're launching to match people with medical training. Would this include people who were trained internationally? There are thousands who would like to be working on the front lines here. There is a call to allow them to work. Would you lift those restrictions to allow them to practice as well? And if not, why not?
I think we need all hands on deck, and it all depends on their training is going to determine where they're put within the healthcare system. But I will pass this over to the Minister of Health.
Well, thank you, Cynthia. We certainly are looking at people who were trained in other jurisdictions, as well as retired people, students, and so on. And what we're trying to do is match the employer's needs with the skill set of the person that's coming forward. So they may or may not, depending on their skill sets, their experience, and so on, be able to practice medicine, but they will certainly have a place within our healthcare system. And as the Premier said, we do need all hands on deck at this point.
Thank you. And my next question is for the Premier. Premier Ford, until last Friday, we had a steady and increasing number of cases. Since then, we're seeing a decline in new cases and hospitalizations, slower growth in hospitalizations. Are the measures taken to flatten the curve working, or are we just measuring less, testing less? We know that we have a very small rate of testing compared to other provinces. We're half of Quebec's, for example.
Let me address the Quebec figure. First of all, our goal is always to increase testing. When I checked, they were 13,000 more tests, and that was as of, I think, April the 4th. But we have to increase the testing. We have the reagent supply. We sat down with our command table yesterday, and we have a solid plan of increasing testing right across this province. But we should never sit back. This can come with vengeance. If we see a little decline, by no means should we be sitting back and thinking that the curve is going the other way. If we see 2-3 weeks of the curve going down, then we're going in the right direction. But that doesn't mean let up in any means. We have to keep going hard, right to the end, every single day, every single minute.
Next question.
Next question comes from Travis Danrush of Global News. Please go ahead.
Hey there, Premier. So I know that you have been working from Queen's Park over the past few weeks alongside your staff and ministers, and I also know that you've been out in the community as a function of your job. We saw you, I think that was this morning or yesterday, helping out load some PPE. British Prime Minister Boris Johnson's sickness shows the importance of having continuity of governance. Do you have such plans if either you or the Deputy Premier fall ill?
Well, let's hope that doesn't happen, and I just want to wish the Prime Minister a speedy recovery. And outside of being down here, we keep our social distancing when we're down here, and then I'll go to my Etobicoke office myself, maybe one other person. I work the phones till midnight, and so we have to practice social distancing anytime I'm out. Like, for instance, today at Woodbridge, I never went inside their plant. I made sure that I wore gloves and a mask anytime I'm out. But I'm trying to avoid that as much as possible.
And just to follow on Cynthia's question about testing, there are reports that the number of testing done in Ontario is actually going down and not up. Can you update us on what is being done to increase testing capacity and meeting that goal of 5,000 tests a day? And why is Ontario doing the least amount of tests per capita than any other province in the country?
Well, I'll pass that over to the Minister of Health.
Well, we've currently conducted over 80,000 tests in Ontario, and we did deal with the backlog, which you know was fairly substantial. So now we are looking at the current situation. We are increasing our testing, particularly in areas that are most vulnerable. And I would say now that would be long-term care homes, retirement homes, and Indigenous communities, and any other places where there's congregate care. We have developed a strategy in order to be able to increase that testing there, and we are able to process, as things stand now, about 14,000 tests per day. So we got rid of the backlog, we increased our capacity for testing, and we're moving forward, particularly focusing on those areas where we really need to build that iron ring and protect those most vulnerable people in Ontario.
Next question.
Next question comes from Alison Jones of Canadian Press. Please go ahead.
Hi, Premier. Just to follow up on Travis's question, would you consider further isolating yourself as a way to sort of lead by example, what we're asking the rest of the province to do?
Well, I think for the most part, I isolate all night, right till midnight, and outside of being down here with a small group of people, and we do our social distancing. I'm just not out and about. I'm either here or in my Etobicoke office, one of the two, and I think it's important that I come out and I talk to the people of Ontario every single day and keep them informed. But for the most part, I'm self-isolating every day.
And to follow up on Laura's question earlier on Ontario's supplies, yesterday you had said we had about a week's worth left of PPE. I'm wondering if you can give us a new assessment given the developments with the 3M deal and now Woodbridge starting to produce the masks.
Well, it's a lot better, and the numbers are so fluid. They're moving constantly. We could get a shipment of 100,000 masks in one day, and it moves the needle. We have people donating every single day. But if you're asking me, is today better than yesterday? The answer is yes. The answer is yes, based on Woodbridge, based on the 3M agreement, and we have to get more clarification on the 3M agreement and getting quantities up here. But it's a better day than it was yesterday, and I think every day moving forward, we're getting more masks, more items in, more people and businesses producing the gowns, for instance, and the face shields. We have a tremendous amount of companies out there producing these face shields. That's probably number one over any other item that we're producing here, because there's quite a number of companies out there doing that. The hand sanitizer seems to be a good supply of hand sanitizer as well. The biggest challenge all the time are the level 2 surgical masks and the N95 masks.
Next question.
Next question comes from Randy Rath from CHCH-TV. Please go ahead.
Hi, Premier.
Hi, Randy.
My question is for Minister Elliott.
Yep.
Minister Elliott, you've asked pharmacies in the province to only dispense 1 month supplies at a time of prescription drugs. I'm wondering if you could explain the reasoning behind that. And are we in a position where the supply chain for common pharmaceuticals like blood pressure medication, diabetes medication is in jeopardy?
Well, we know that there are some concerns with respect to drug supply, both with obtaining items for certain drugs from international sources. because everyone's asking for them, but also internally because people have been asking for larger supplies, 3-month prescriptions instead of 1-month prescriptions. We want to make sure that there's enough for everyone who needs particular medications. That's why we've asked pharmacies to only supply in 1-month intervals. We are currently looking at a mechanism to allow for the dispensing fills that otherwise would have been done once if people got 3-month supply as opposed to 3 now. We're looking at a way to resolve that for the benefit of the consumer, but we just want to make sure that there are enough supplies for everyone who needs particular medications to be able to get them.
Okay, and my other question is, we have this document that's from the Ministry of Health, and it's called the COVID-19 Triage Protocols for Surge Capacity. And what it states is that people with certain underlying illnesses and people with some disabilities, diseases like Parkinson's and ALS, in the time of a surge would be denied critical care beds. Is this true? And what point would we reach that hospitals would have to implement this type of thing?
Well, I would tell you that that's a draft document only. That one has not been approved yet. It has been prepared, but it still needs to go through cabinet review and final review. But I know that there have been some concerns that have been expressed by people with certain disabilities that they would be cut out of treatment if we got to that point. That is certainly not what that document is meant to deal with. I would never allow that to happen. People with disabilities are treated in the same way as everyone else, as they should be. But that is, as I said, that's a draft document. But that document would only come into effect if all else failed. If we had everything brought into surge capacity and we still found ourselves without enough beds, without enough ventilators. We are certainly not at that stage yet. In fact, right at the moment, we are under the best level modeling that has been developed for us. So while that's encouraging right now, as the Premier says, we can't sit back and rest on our laurels. We have to be vigilant. We have to maintain full support for all of our frontline professionals and keep making sure that we have the personal protective equipment that they need, that we have the people that we need, which is why we came forward with this announcement today. We need to make sure for increases so that we will be able to handle them if and when that happens.
Next question.
Next question comes from Colin DeMello of CTV News. Please go ahead.
Hi, this is a question for both the Premier and the Health Minister. Premier Ford, I wanted to revisit something you said yesterday about sanitizing masks for reuse. Can you tell us how serious Ontario is about having to take that step?
It's an option. We aren't there right now, Colin, but it's just another option on the table. As I say, everything's on the table. It's working quite well in Quebec, but it's backup. We have to have every option possible out there, but right now we aren't at that point.
So Ontario hospitals are now being told by the Deputy Health Minister to save all of their used personal protective equipment as the province kind of investigates whether they can be sanitized and what the protocols are for that. Do hospitals right now have the equipment needed to sanitize PPE, and why are they being asked to keep all of this used equipment if it's just a worst-case scenario option?
Well, it's always better to be safe than sorry, Colin, and there is a company in Ottawa that does disinfect and sanitize this type of equipment, but it's better to have it stored there, and if we need it, then we'll do it. But right now, we aren't at that point.
Next question.
Next question comes from Lisa Shing from CBC. Please go ahead.
Hi there, everyone. First question for the Premier. The ROM is issuing layoff notices to staff, and execs are taking a 20% pay cut. With that said, are you considering ordering execs at other provincial agencies to also take a pay cut if they have to lay off any staff? What comes to mind is, OLG, Ontario Lottery and Gaming, with so many casino staff laid off.
Well, first of all, they're agencies. They have a certain amount of money to work within their parameters, and without visitors, they've run out of money. But this is a great question that our finance minister can answer that as well.
Yes, thanks for the question. So, as the Premier mentioned, many of these organizations, the ones you talked about, are agencies of the government with independent boards. So we've encouraged them to look at what they need to do and in this circumstance and support that. And we're going to be continuing to look at those kinds of options. You can appreciate, as the government works its way through this, we want to make sure that we have the resources available, the vital resources to support healthcare, which we're talking about today, also support communities and jobs. So we're absolutely support the various agencies looking at their contingency plans and what they need to do to make sure that they're protecting those the vital resources we need, particularly for healthcare right now.
Thanks very much. And my follow-up is for the Premier. We've learned that the residents in Pinecrest Nursing Home in Bobcaygeon, those who tested positive, were not actually separated from the residents who were uninfected until 16 people had died. Wanted to know your reaction to that and why long-term care homes weren't given stricter orders to separate infected and uninfected residents.
Well, this would probably be better answered by my Minister of Health there.
Well, first of all, it's heartbreaking to hear of the deaths at this long-term care home. Our condolences go out to all of their families. But this is something that is being dealt with by the local public health units, that they went in as soon as they found out what was happening, and they have been working with them ever since to make sure that the proper testing is being done, that the proper isolation is happening, and that if any residents need to be taken to hospital to be on ventilators, that is happening as well. So we are relying on the assistance of our public health authorities, who have gone in and have taken control of the situation and are doing their very best to make sure that all those very vulnerable residents are protected.
Next question.
Next question comes from Rob Ferguson from the Toronto Star. Please go ahead.
Hello there. Probably more for Minister Elliott on the first one here. About the international medical grads. So from what you said earlier, I understand this is all just volunteer. I'm wondering, will any of these people go into this portal? Will there be any pay for them? As we all know, there's foreign trained doctors here that are doing various other things that are not medical. And will there be a better path for them when this is all over to have their credentials recognized here?
Well, first of all, of course, people will be paid for the work that they're going to do, although some people have indicated that they really just want to be volunteers. We will certainly respect that, but many people are expecting to be paid, as they should be, for doing this kind of work. For foreign trained professionals in other jurisdictions, that of course we're going to have to match them with their appropriate skill level into the kind of work that they will be able to do. So they may or may not, as I said before, be able to practice medicine, but they will certainly have a role within our healthcare system. And going forward, that will certainly be experience that will be important for them in order to obtain their credentials provincially. That's something that we will have to take a look at once we are through this. But right now we're really concentrating on dealing with COVID-19 and making sure that we get as many people as possible as frontline healthcare workers to deal with increases in the number of patients.
All right, and just as a follow-up, Minister, what kind of things could you envision, a doctor, for example, who was trained and certified and worked in the Congo, for example, what kind of work would a person like that be allowed to do in the healthcare system with COVID?
That, I would say, would really be up to our medical professionals who would be taking a look at each person's credentials, experience, qualifications. I am not a medical professional, so I couldn't really venture to say on that, other than to say that they would have a very important role. All of the work on the front line is really important.
This will be last question.
The last question comes from Christina Tenaglia from CP24. Please go ahead.
Hi, thank you, Premier. Thank you, Minister. I'll start with Health Minister Christine Elliott. We have heard from some people who have lost their jobs, and because they've lost their jobs or their partner has lost his or her job, they no longer have health benefits. And of course, while the federal CERB provides some income, some people, we're hearing, are unable to afford some of the prescriptions they need. What can the provincial government do about this? What would your advice be to these people from filling that void?
Well, we're going to make sure that people who are otherwise eligible for OHIP coverage will continue to have coverage through this pandemic. We don't want anyone to be denied either health care or prescription care. So we are going to make sure that that those people will be covered, because we want to make sure that they can stay safe and healthy and that their families can as well.
Okay, I guess what I was referring to is the kind of prescriptions that OHIP doesn't cover. But I do have a question for the Premier, if you're not able to elaborate.
Follow up, Christina.
Okay, so for the Premier. Premier, we've done a story on this. We've received a lot of images about this, about people littering their gloves outside grocery stores, inside shopping carts, all around the city and beyond in the province. I'm sure you've seen the images. We understand some municipalities are taking action to fine people. Should municipalities in the province be more aggressive with this? Of course, litter is awful, but the possibility of contamination, having these gloves everywhere.
Yeah. I agree 100%. This conversation's come up numerous times. I encourage everyone, number one, don't litter. We live in a beautiful country, beautiful province. Simple as that. Don't litter. It doesn't matter if it's a candy wrapper or whatever. Wait until you get into an area that you can dispose of it. If you dispose of gloves or masks, again, you could contaminate so many different areas and people on the ground. Throw it in a waste basket. The other thing, Christina, I got a call from Diabetes Canada, the boxes that people donate the clothes. They can't empty them now because people are using them, to clean out the garage and start dumping everything in these boxes. So please, they've asked me to mention, do not drop anything else off there, because every box you go by just seems to be cluttered full of different items outside, and they can't get to the box. So I agree, do not litter. Don't litter at all, but don't litter the face masks and the gloves. That's contagious. I just hold on to them, throw them in the garbage. Christine, I know this is the last question, but on a little lighter note, I know it's so tough for the younger kids to explain with their, from their mom or their dad, what's going on right now. And the kids have simple things that they're worried about. They're worried about, I've heard, the tooth fairy. They've heard about the Easter Bunny, and I've seen what New Zealand has done. I heard the mayor this morning too. So the kids, the Easter Bunny has become an essential service, and they'll make sure they have the chocolates ready for Easter. So I know it's tough on families right now, and just enjoy Passover and Easter to the best of your ability, and thank you. Thank you so much, everyone.